It's the worst disease I've ever seen in my life.
Millions of Americans are living with Alzheimer's disease.
I will not sugarcoat it. There are hard days.
And families are on the front lines of care.
You don't have to face this disease alone.
Today, we're talking about care for the caregivers.
We have sacrificed a lot, mentally, emotionally, socially, and especially financially.
And the Bay Area research showing how simple pleasures can bring back memories.
There's a moment of just, this is what it tasted like, and the stories flow.
This is CBS News Bay Area with Elizabeth Cook.
I'm Ann Makovec in for Liz, and millions of Americans are living with Alzheimer's or some other form of dementia. If you know somebody who's been through it, you know it's a devastating diagnosis, and suddenly people around them find themselves in an overwhelming new role as caregiver. But there is help, and some new research offers hope in the ability to unlock memories. We're going to have that conversation coming up in just a few minutes. All right, the Alzheimer's Association says nearly 7 million Americans are living with Alzheimer's. That number is projected to rise to 13 million by the year 2050. The disease was the fifth leading cause of death among people 65 and older last year. The health and long-term care costs for patients expected to rise to $360 billion this year. Incoming President Trump has proposed some relief for family caregivers. He promised a tax credit for those taking care of parents or loved ones. The AARP found that caregivers provided $600 billion in unpaid service in 2021. That's not even really the full picture here. National consumer correspondent Usher Karashi looks at a tool to help families estimate the expense of caregiving.
So I renovated this bathroom to make it easier for my dad. It was your
Safety-proofing her aging parents' home was an expensive undertaking for Amy Goyer.
And when you've got someone with dementia, you don't know if they're going to lift their feet or not. Their feet are shuffling. It got extremely dangerous.
The home is filled with memories of a lifetime, clouded by the stress of caring for her mother after a stroke and her father with Alzheimer's.
When he went in hospice care, they're like, you don't have to shower him every day. I said, you don't understand. That's the best part of his day. We're absolutely doing this, you know. And up until the day he died, we were able to do that. He was amazing.
So how much of a financial strain was this on you?
It was financially devastating for me. And so I don't have regrets about anything I did in caring for my family. But I ended up in bankruptcy.
She wasn't just a caregiver in her personal life. She's AARP's expert on caregiving, helping families find resources for aging adults.
Some people are doing complicated nursing tasks. They're doing things that you'd be paying a lot of money to get. We're using medical equipment. We're dealing with oxygen and checking blood sugars and doing a lot of medical and nursing tasks. How are you ever supposed to take care of yourself?
More and more people are facing this question. According to the Harvard Business School, 3/4 of American workers now have a second job caring for an adult family member in their off time.
Like Sean Lowe, who's been caring for her mother along with her siblings since the impact of Alzheimer's started nearly a decade ago.
Are there resources, financial resources, to help you care for your mom, balance your work life, your personal life, your family life?
Not personally, not that I'm aware of.
We showed Lowe a unique custom tool by Salary.com. It calculates the cost of caring for someone based on time, type of work, and where you live.
Here we go.
Oh! Wow.
Stop. $270,000. And we're getting zero.
That's the projected salary for taking care of her mom. Without financial help, Goyer says families end up passing down debt from one generation to the next.
We largely don't have enough support. And what we're doing is we're putting our financial security of our caregivers in jeopardy in the future. So they're not going to have the money to pay for somebody to take care of them.
In a new report to Congress, the Family Caregiving Council proposed several solutions, including providing states more money for caregiving programs, offering a federal tax credit for family caregivers, and immigration reform, allowing more workers in to meet the caretaker demand, all of which require congressional action. Usher Qureshi, CBS News.
Well, there is no cure for Alzheimer's, but there could be a way to help unlock memories. Coming up next, how scientists are tapping into the nostalgia of food to help patients remember. The Alzheimer's Association says more than 700,000 Californians were living with dementia in 2020, and Alzheimer's kills more people than breast cancer and prostate cancer combined. There is no cure, but there is some hope. Our Itai Had looks at a new experimental program in San Francisco that is helping dementia patients remember with the help of their favorite childhood meals.
Most dinner parties are about creating fun memories.
You always like to wear your scarf?
Yes. But for 87-year-old Arthur Shostak, tonight is about retrieving them.
Okay.
Once a professor, Arthur's words don't come as easily as they used to. His son Mark says his memories are slipping away.
He is asking within a short period of time about things that we had just discussed.
This evening, Arthur is getting ready for a special meal designed to stir up his senses. For 2 weeks, he's been working on recreating one of his favorite dishes from his childhood. His mother's recipe for a Jewish potato pancake called a latke.
You have to grate the potatoes, you have to grate the onions, you have to get used to the tears.
It's those kinds of memories that Jake Broder, a fellow at UCSF's Global Brain Health Institute, is trying to unlock.
We work with people every day and do interviews and test kitchen until they go, there's a moment of just, this is what it tasted like, and the stories flow.
Studies have already shown that music can unlock memories from the past. Dr. Adrian Green, the CEO of the San Francisco campus for Jewish Living, is betting the same can happen with food.
They're just coming to life in ways that we don't see every day.
During a dinner party, residents share their dishes with a group and read a story they wrote with the help from specialists.
I would sit across the table from her and ask her a very important question. Sour cream or applesauce?
For his son Mark, it's a rare moment of hope.
That was wonderful to hear.
Making this a night to remember.
Very good.
And it's not just San Francisco either. Future dinners are planned in Madison, Wisconsin, and Portland, Maine. Researchers hope those meals can provide more data to study. Well, joining me now is Claire Day, the Chief Program Officer for the Alzheimer's Association of Northern California and Nevada. Thanks for joining us, Claire.
Thank you.
Now, for somebody diagnosed with Alzheimer's today, versus maybe 20 years ago, is the prognosis significantly better?
So it's not necessarily that the prognosis is better. I would say the disease is going to progress the way that the disease progresses. But what we have for the first time is hope in the form of treatments that may improve our memory for an extended period of time, anywhere from 6 to 12 months even, where someone can really capitalize on that time to continue to live the highest possible life that they could live in those earliest stages of Alzheimer's disease.
And what would you recommend people do during that time?
So I think what's really important is even anyone, when they're diagnosed, should do the things that are really important as far as some of the legal things, right? You want to think about who you want to make your healthcare decisions. You want to think about your finances and what kind of care you'd like. But I think it's also important that time allows you to live your life, to think about the things that you can do that will engage your brain, like eating right and exercising and doing those cognitive and social exercises as well. All really good things, even for people with dementia. But we're also learning there may be going to be the keys to unlocking, reducing our risk as well.
Now, Alzheimer's has touched almost everybody's life in some way, shape, or form. My grandma passed away of it several decades ago. What do you want people to know about this disease that maybe they don't?
I think the most important thing to think about is there is hope, there is help for people who have Alzheimer's disease or a different type of dementia. And I think we need to talk about it. We need to normalize this this disease. There are so many people who associate Alzheimer's disease with normal aging. That's just not the case. And I think we need to really talk about what Alzheimer's disease is and the fact that there's hope and help out there for people. There are things that we can do to support caregivers. We have educational programs. We have our 24-hour helpline. There are so many support services available in the community for people living with Alzheimer's disease as well as for their care partners. You should not face this disease alone.
Now, I think one of the big decisions is whether or not to try to care for somebody in your home or move this person to a facility, a very emotional decision. How should people approach that?
I think that it's a very individual conversation for families to have. And I think that really what you need to look at is not just what's the best thing for the person with dementia, but also what's the healthiest thing for the caregiver. And that, some families have the capacity to be able to keep someone in the home throughout the duration of the disease. But for those who don't, it can be a burden on caregivers. It can be a physical and emotional toll. And so look for those support services when you need them and don't be afraid of them, because I think there is no right or wrong answer for families. Families have to do what's best for that individual, and that's never going to be the same from person to person.
What do we need to see more of in the way of research?
Yeah, so I think we just need to see this momentum of research continuing. We have a lot of great momentum moving forward when we think about Alzheimer's disease in particular, some new monoclonal antibodies, which is a new treatment of medicine that is really for the first time addressing the underlying biology of the disease. But we're also seeing trends in understanding what puts us at risk. But we need to also see, I think, more research in the future looking at related types of dementia like vascular dementia, Lewy body dementia, frontotemporal degeneration. There's still, I think, so many unknowns we don't know about that. Different biology in the brain that's causing that loss of function that we know of as dementia, but the underlying biology is different. And some of these new medicines won't work on people unless they have Alzheimer's disease. So we just need to keep that trajectory moving forward.
All right, and hopefully one day find a cure. Claire Day with the Alzheimer's Association, we really appreciate you and all the work you do.
Thank you.
We're going to be right back. Thanks for watching. You can always get all the latest headlines and weather over on KPIX Plus. And remember to like and click the button on the bottom left of your screen to subscribe for the biggest Bay Area news.